Greetings and welcome to the Kane County Health Department Opioid Overdose Prevention and Naloxone Training. This training will provide a brief overview of our program and the use of naloxone for the reversal of an opioid overdose. In this video, we'll talk about the opioid overdose problem in Kane County, the state of Illinois, and the country. We'll learn how to identify and respond to an opioid overdose and how to give naloxone to someone who may be experiencing an overdose. Naloxone is distributed under the brand name Narcan. You may have heard about our country's opioid epidemic on the news, and this graph shows the rise of opioid deaths in the United States, and notably, the rise in deaths related to synthetic opioids like fentanyl and tramadol. In the United States, sadly, 224 people died each day from an opioid overdose in 2022. In Illinois, we have seen a 9.7% decrease in opioid deaths from 2022. This is the first decrease in opioid deaths since 2018. Deaths from synthetic opioids like fentanyl decreased by 9.5% in 2023. This decrease is attributed in part to increased naloxone distribution, more people being trained on how to give naloxone, and other harm reduction efforts. In Kane County, from 2018 to 2023, there were 2,224 opioid-related overdose visits at Kane County emergency departments. 417 Kane County residents died from an opioid overdose during this time, and the average age of death was 40 years old. 70% of those deaths were male. In 2023, there were 93 deaths from all types of drugs, and 76% of those involved opioids. While not all overdoses are reported, in Kane County, first responders reported 95 uses of naloxone to reverse overdoses, and of those, 82 were reversed. 13 individuals did not survive, or their outcome is unknown. 54% of overdoses took place in the home, which emphasizes the need to have naloxone directly in the hands of community members. Now, let's learn about opioids. Opioids are natural or synthetic substances that act on the brain. They can be prescribed by a healthcare provider, or they can be used illegally. When used properly, opioids provide relief from pain and anxiety. Opioids are risky because anyone experiencing the pain relief or pleasure received from opioids is at risk of dependence or misuse. Some examples of opioids are codeine, OxyContin, Vicodin, morphine, heroin, fentanyl, methadone, and many others. During an overdose, opioids overwhelm receptors in the brain and cause breathing and heart rate to slow down or stop. An overdose usually occurs over 1 to 3 hours, although overdoses with fentanyl can occur more rapidly and sometimes immediately. An overdose can be caused by taking more opioids than prescribed, combining opioids with other depressants such as alcohol, and taking more opioids than one can tolerate. The risk of an opioid overdose increases when switching between prescriptions and mixing opioids with other substances like alcohol. Having chronic medical conditions increases the risk of an opioid overdose because these folks are more likely to be prescribed opioids. A recent release from detoxification programs, jail, or emergency care following a previous overdose also increases the risk of an overdose. The good news is we can prevent opioid overdoses. Always avoid counterfeit pills and only take pills prescribed to you. Pills bought illegally might contain highly potent drugs like fentanyl. Fentanyl test strips can detect the presence of fentanyl in drugs and are available for free from the Kane County Health Department. People who use drugs have the option of seeking treatment for substance use disorders and consider medications like buprenorphine, which is a safe and effective treatment for opioid use disorder. And finally, don't use alone and always have naloxone available. Naloxone is free from the Kane County Health Department in over 100 different locations across Kane County. It's important to know the difference between someone who is really high and someone who is experiencing an overdose. Someone who is really high will have very relaxed muscles. Their speech may be slow, or they may be slurring words together. They may look sleepy, but they will respond to things like shouting, a sternal rub, or an earlobe pinch. They'll have a normal heart rate and pulse and normal skin tone, whereas someone who's experiencing an overdose may have pale or clammy skin, infrequent breathing, or breathing may have stopped altogether, deep snoring or gurgling. They will not be responsive to any stimuli. They'll have a slow heart rate or no pulse at all, and blue lips or face. Now, we'll learn how to respond if you think someone may be experiencing an overdose. When you recognize the symptoms as discussed in the previous slide, try to wake them up with a sternal rub, an earlobe pinch, or shouting their name. You'll then do whatever you can do faster, calling 911 or giving naloxone. If the person is not breathing, rescue breathing can be started as you wait for emergency responders to arrive. It's important to stay until help arrives to keep the person safe and to communicate with emergency personnel. We promote the use of naloxone because it's highly effective at reversing the effects of an opioid overdose and it saves lives. Anyone can be trained to give naloxone. It's also very safe. It's as safe as water and there's no potential for addiction or misuse. It can be used on anyone, including pregnant women and children, and it won't hurt someone who is not taking opioids. So if you come in contact with someone who is unresponsive and suspect an overdose, but are not sure, you can still give them naloxone safely. Naloxone works by pushing opioids off of the receptors in the brain. It starts working after 2 to 3 minutes, and it works for about 30 to 120 minutes, which is often less than some opioids. That means that we can only use naloxone to buy time until emergency responders arrive, because when it wears off, the person may experience another overdose due to opioids still in their system. Naloxone will not reverse overdoses caused by drugs other than opioids. Now, let's learn how to save a life with naloxone.
Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. Please see indications and important safety information at the end of this video. Also, please see accompanying full prescribing information in the use of this product. Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help reverse an overdose. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders, shout their name,
Kevin,
and ask if he or she is okay.
hey, can you hear me?
Then check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open the Narcan nasal spray blister pack. Remove and review the printed Quick Start Guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care. Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril. Acute opiate withdrawal symptoms may occur from use of Narcan nasal spray in patients who are opioid dependent. Symptoms include body aches, diarrhea, increased heart rate or tachycardia, fever, runny nose, sneezing, goosebumps, also known as piloerection, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness and increased blood pressure. When the emergency is over, put the Narcan nasal spray back in its box and throw it away in a place that is away from the reach of children. In addition to watching this video, please read the quick start guide that comes with Narcan nasal spray before using it. Talk to a healthcare professional if you have any questions about how to administer Narcan nasal spray.
As mentioned in the video, if the person does not respond to the first dose after about 2 to 3 minutes, go ahead and give the second dose in the other nostril. There are 2 doses in each box. If still unresponsive, lay the person in the recovery position as shown. We want to repeat that naloxone is not a substitute for calling 911. The person experiencing an overdose still needs care and must be seen by emergency personnel after receiving naloxone. Stay as long as you can or until help arrives. If the person becomes responsive, they will be confused and may not remember overdosing. They may experience the withdrawal symptoms discussed in the video. They may be angry or become combative because their high is gone or their pain has returned. Discourage them from taking more drugs and try to comfort them until help arrives. Rescue breathing is recommended for people you feel comfortable doing it to, like close friends or family, or if you have a one-way barrier device. Begin by checking that their airway is clear, then place one hand on the person's chin, tilt the head back, and pinch the nose closed. Place your mouth over their mouth, make a seal, and give 2 slow breaths. Their chest should rise, but not the stomach. If the stomach rises, it means you've overinflated the lungs. Give 1 breath every 5 seconds until the person can breathe on their own or help arrives. If you're hesitant about calling 911 for someone who is overdosing because you're afraid you'll get in trouble, the law protects you. Don't run, call 911. If someone calls 911 or takes a person to an emergency room for a potentially fatal overdose, they cannot be arrested or prosecuted for being in possession of drugs or drug paraphernalia or being under the influence of drugs. The same protection applies to the overdose victim. This does not cover driving under the influence, so be safe and call 911. Store naloxone in its original package, protected from light, at room temperature between 59 and 77 degrees. It's important not to let naloxone freeze because it can become unusable. You should also not wait for frozen naloxone to become a liquid before taking action. In that case, just call 911. Naloxone should not be exposed to heat above 104 degrees, so be careful when storing it in your car. Naloxone expires in about 4 years, but it can still be used to save someone's life if a fresher box is not available. For more information on where to get naloxone for free at over 100 locations across Kane County, local substance use treatment resources and data, visit the Kane County Health Department website at overdoseinfo.org. At overdoseinfo.org, you can also watch videos featuring local people with firsthand experience with substance use, harm reduction, and successful treatment. Behavioral Health 360 is the Kane County Health Department's free mental health and substance use self-help website where you can take mental health assessments, learn about common behavioral health concerns, and find local resources to help. Visit kanehealth.com to explore and start your journey toward emotional well-being. Thank you for taking this important step towards saving lives in Kane County. If you're in need of naloxone for your organization or business or would like group training, email phd@opioidinfo@kanecountyil.gov or call 630-208-3801.